So thank you, everyone. I think we will make a start, and welcome to NHS Tayside's annual review. For those of you who don't know me, I'm Lorna Burr-Stewart. I'm chair of NHS Tayside Board, and today, together with Nikki Connor, who I'm delighted to introduce you to, was appointed as our substantive chief executive in July this year. So Nikki and I will be hosting the annual review for 23-24. We're joined by members of the board, executive and non-executive colleagues, many of whom are here in the room, but there's also quite a few people on, I think, on Teams as well. This review is an annual event. This is my 6th annual review and my last annual review, because for many of you will know I am retiring in the early spring of next year. The aim of the annual review is to set out how effectively the board is delivering services to our populations across Tayside. And today's session is primarily looking at performance for 23-24, but we also wanted to take the opportunity to look at the current financial year and also to share with you some of the challenges that we have currently and will have going forward, and as we move to month 9 of the year 24-25. So all boards across Scotland are required to deliver an annual review, which is part of the process of holding boards to account for the very large sums of public money that we are responsible for. So today, Nikki and myself will take you through a presentation of our key performance and areas of challenge, and then we'll move to a question and answer session at the end. We've offered the public and staff the opportunity to ask questions in advance, and I've got a number of questions that we have already. However, we will be able to take some questions in the room if we have time at the end. And if we run out of time, a commitment from Nikki and I that we will respond to any questions following the review, and these we will put these available on the website so that everybody can see the questions and the answers. I have to say at the outset, and just for awareness, that in the same as any annual review with any board, we are not able to answer questions. In fact, it's inappropriate for us to answer questions relating to any individual patients or any cases. So if you would bear that in mind if you do have questions, thank you. Also, this session is being recorded, and it will also be available on the website in the next week or so. So I'd like to begin the review to say that it's fair to say that NHS Tayside, along with all other health boards and systems across the UK and indeed in Scotland, we are all facing unprecedented challenges. This summer, the Scottish Government set out a new direction for health and social care across Scotland, recognising the urgent and critical need for health and social care reform within the context of what we know to be an ageing population, persistent health inequalities, and significant fiscal pressures. So the Cabinet Secretary for Health set out a clear path for reform, focusing on a more sustainable healthcare system and focused in 4 key priority areas. You may be familiar with those, but I wanted to share them with you. So the first is improving population health, a focus on prevention and early intervention, providing quality services and maximising access and equality of access. So the announcement from the Cabinet Secretary came with a new overarching vision, and that vision we also share and embed in the work that we do. It's a Scotland where people live longer, healthier and fulfilling lives. This vision and the 4 key priority areas that I've just outlined to you underpin everything that we are trying to achieve here in NHS Tayside. These really are the bread and butter of what our teams strive for across health and social care every day. I would like to take the opportunity right at the beginning and at the outset to thank all of our staff. And I'll come on to, throughout the presentation, Nikki and I will be referring to our staff and our workforce. These times are testing for all of us. We've all been through testing times, as we know, during COVID in particular, and we are tested. We ask a lot of our staff every single day, and they keep rising to the challenge. And when things get tough, they step up, they go forward, and they go again. And on behalf of the board, I would ask, please, that you like to thank all of our staff, and for those that are involved with staff-facing jobs and opportunities, please thank the staff on behalf of the board for everything that they do. So we're going to start today by grounding everyone in NHS Tayside, who we are, and setting the scene for the work which our amazing teams are delivering day in and day out. So we're going to move to slide now. So the slide that you have here is high-level information. So what we've tried to give you is an overview. So in terms of staff, we've got over 14,000 staff across multiple job professions and teams in acute and community settings. In terms of the budget, we've got an annual budget of 1.2 billion. That is public money, as a significant amount, as I'm sure you will all agree. And as a board, we have to be accountable for this in the most transparent way for the communities we serve. So that in part is what today is about. And I trust that everyone who is attending in the room, but also watching today, will see by the end of this presentation how our teams are ensuring that we get both the best value for money, whilst also delivering the most effective services. So, and then we have geography, bottom left there. We cover a pretty large area in Tayside. We're the 5th largest board in Scotland, around 3,000 square miles spanning across Dundee, Angus and Perth and Kinross, as well as some of North East Fife. And we're delivering services to both built-up urban areas, as well as those which are rural, and sometimes even very remote in places of Highland Perthshire and Angus Glens. So more than 415,000 people rely on us for the services that we provide, and we need to keep improving and innovating to make sure we tailor services to all our communities. Then we move to our health and social care partnerships. So we partner with 3 health and social care partnerships across Dundee, Angus and Perth and Kinross to do just that, how we tailor our services to all our communities. So the health and social care partnerships, referred to as HSCPs, the teams there really are, they are the experts in delivering for the specific needs for our communities within the community setting. So then we move to our properties and estates. So looking at our properties and estates, we have 65 owned, directly leased or PFI premises, plus GP premises on top of that number. So the estate covers 428 square meters of land, buildings, and many of these are old and aging. Indeed, here at Nine Wells, some of you will know that we've just celebrated our 50th anniversary of this wonderful institution that we have here. That means Nine Wells is actually one of the oldest hospitals in the country. And as a result, we are not immune to the challenges that an aging estate brings. We have one of the largest and the oldest estates in Scotland, and it's actually something of a challenge on which we currently work and will continue to work. We also, as many of you will hear, of anchor institutions, anchor organisations, and here in Tayside, NHS Tayside, we are an anchor institution. We're an anchor organisation. The best way to describe that is that we're an exceptionally large organisation whose long-term sustainability is tied to the well-being of the populations that we serve. Anchors get their name because they're unlikely to relocate, and we certainly are unlikely to relocate given the connection to our local population. And we have significant assets and resources which can be used to influence the health and the well-being of our communities. So here in Tayside, we are now pursuing actively a strategy which intentionally manages our resources and our operations to address local social, economic and environmental priorities. because our driver is that we need to reduce health inequalities, especially across our areas that I referred to, our urban, remote and rural. So what this slide shows is that we are a huge organisation with a level of complexity and interconnectedness with our communities, and that's really quite unique. So as a board, we are really privileged to lead the organisation, and as I said, we have a number of, the board is made up of executive members who are here led by Nikki, and non-executive members, many of whom are here and online. And we are, on behalf of the board, I just want to reiterate how proud we are of the staff who deliver everything that I've just talked about in this huge structure that we have for our populations. So now we move to the next slide, and it's a balancing act for the people of Tayside to live longer, healthier lives. I referred to what the Cabinet Secretary, the vision that they own. So I'm now going to take us into the review of 23-24. And what a year that was. The main learning point from last year, which is continuing this year, is a very fine balancing act which our teams and our staff must undertake each and every day. So how do we tackle the need for financial savings with effective performance? And how do we do that while maintaining quality and patient safety? But also, really importantly, ensuring that our staff are also cared for. So of course, these are all interlinked, they're connected. One has a bearing on all the others, and therefore it's imperative that we work with our staff and our partners and make sure that we consider all four of these elements together, but at the same time when we're making decisions. And also, and really importantly, we've really got to be true to our vision, that overarching vision that the people of Tayside live longer, healthier lives. So if we make sure, and as a board, the chief executive and myself, that we have and embed that vision as our common goal and at the heart of everything we do, and that cascades from what Nikki and I, as the chair and the chief executive, and that cascades through our executive and our non-executive leads for the organisation through to our staff. And if that is our common goal on the heart of everything, then this will really help guide us through what we know are really challenging times. So today we're going to look at these four areas for 23-24, finance, performance, quality and people, alongside a look at the year ahead. So on that note, we shall start with our finance and our financial position. So the slide shows our financial outturn for the year 23-24, which was a 15.9 million overspend. And as I've said, it's our total budget of 1.2 billion. So we received 16.1 million from Scottish Government to achieve financial balance, alongside a number of other boards supported by Scottish Government in terms of money received to help us achieve, where possible, financial balance. In addition to that, our teams also made significant savings of more than £40 million, and that was £10 million ahead of the planned savings. And again, it's testament to our teams across the organisation, but also to the leadership within our finance teams. And again, teams across the organisation are being asked to plan and care activity. And they're being asked to do that with diminished resources. And I think that's really important. We're being asked to do the same and more, and to plan care and activity with diminished resources. However, it's really important that we put that in the context of we do receive £1.2 billion. And what the chief executive and myself try to bring with our work and across our teams and the board is a positive approach. We have 1.2 million. So rather than always focusing on what we don't have, we want to focus on what we do have and what we do spend, and the need that we have to show value for money alongside delivering effective services. So we are on track to deliver the original financial plan, and the board signed that off in April this year. We signed that off at a time when there were many unknowns in terms of our funding offer, The Scottish Government budget is still to be agreed, and we will see that will come forward next week. And that may bring further certainty to our position, and we'll be able to clarify and confirm and be a bit more certain about our position. However, we know that these are unprecedented times in terms of the fiscal challenges, and we therefore look and continue to look for every opportunity to be more efficient, but we do not lose the focus on the performance quality and our workforce. So that brings us on to our key performance areas and some areas of challenge that we are tackling. So here's the key performance delivery for 23-24. So first up, we have our performance in the performance section. We have our 4-hour emergency access targets. And I'm really proud as chair of the board that NHS Tayside remains the top performing NHS mainland board in Scotland, around 20 to 25% ahead of the Scottish average in the weekly reported figures. So NHS Tayside, our ED, our emergency departments, continue to record the lowest numbers of 8 to 12-hour breaches. That's wait times over the target. And we very much remain the exception in terms of NHS Tayside emergency departments. Our department, in comparison to many and most of the other ED departments across Scotland, is performing at the highest level. So to put that into perspective, our 8-hour breaches are 0.2% of the total attendances of 9 Wells and PRI EDs. So this consistent achievement is primarily down not only to the whole system team working, but it's also about the culture that's been established around that team working in Tayside. And I will come on a little bit later just to illustrate how proud we are of this, and also of the teams who deliver it in the next slide. So next, moving along the top row, we have our new outpatient waits and our waiting lists. We're consistently delivering more activity, and not a medic, activity. What is that? It's actually about delivering more success against those that are waiting for us for outpatient lists. So we're delivering more activity than planned. And at the end of March this year, we had the second smallest outpatient waiting list across Scotland, calculated at a rate of 100,000 population. We then have diagnostics. And I'm pleased to say that NHS Tayside teams delivered more new outpatient appointments and radiology key tests than the planned activity level. So we set planned activity levels, and we have planned activity levels that we wish to achieve. So again, we were able to deliver more new outpatient appointments. So an example of that is endoscopy delivered 95% of its planned activity. So we then moved to planned procedures. We delivered 98% of electives, and that is important, and it's vital that we do that delivery. But I just wanted to set that in the context of the fact that that was against a backdrop of increasing demand. So we were expecting a certain number of people to present for electives, when in fact we had a significant increase on that demand in terms of referrals and the pressures over winter. When we look at the cancer 31-day target, we are consistently again performing above the Scottish average and delivering on the 95% target to commence cancer treatment within 31 days of the decision to treat. It's not such a positive picture with cancer 62 days. However, in 23-24, we were still performing ahead of the Scottish average in terms of the percentage of patients who commence treatment within 62 days from referral. This is not where we would like to be, and this year we've experienced further difficulties with this target, and I'll be asking Nikki to come on to that in more detailed actions of what we as the board are taking to improve that position shortly. We then have delayed discharges, and again the next measure, which is 23-24, saw a continued significant improvement in the number of delayed discharges across both 9 Wells and PR sites. I really am pleased to say that the improvement work taken between our acute teams and our health and social care partners has been transformative. and we are maintaining that position into this year, which is good news as we are obviously heading into the winter. But do not underestimate how important that effective working relationship and the culture of the teams working together has been. It has been truly transformative, and my thanks to all the teams that are involved in that work. Child and Adult Mental Health Services, CAMS, completes our key performance areas. And in the year 23-24, we have managed to turn the tide on the CAMS performance. The board has had that very much at the top of their agenda, and I'm really delighted that we have been able to turn the tide on that performance. We started 23-24 at around the 60% mark, which is the percentage of children who commence treatment within 18 weeks from referral. And again, through the collaborative work in our teams, we finished the year achieving the 90% target. So we've gone from 60% to 90%. And that is a really excellent achievement by the teams. Appreciating that 60% was a significant challenge to get to 90%. And we will see how we're faring this year, again, in one of our upcoming slides. I'm then going to just go back to ED, emergency department, and why that target is so much more than just a number. We as a board, we are set targets by Scottish Government, but we always challenge ourselves. That's the target, that's what we need to achieve. But we really, really want to achieve and maintain that 4-hour emergency department target. That's not new this year. That has been the case for a significant number of years, and at least for half of my tenure here as chair. It's not a target that's being universally met across Tayside, across Scotland. We are very much the outliers, and so often you're outlier and it's a negative. We're an outlier in the most positive way here. It's a really good way. And in terms of Scotland Mainland Board, we really are doing very well indeed. And again, it might be easy to become a little bit complacent about that and a little comfortable. But I'd like to assure you that the board and our teams are still as committed as ever around that target, because we as a board and our teams have made a commitment. We know what it really means. It's much more than a number. Urgent and unscheduled care remains a priority for NHS Tayside teams, because, and why it's not a number, it's about people. And we recognise that the harm that can come to patients if they're not assessed and they're not treated in a timely way. You will have heard, many of you, as right care, right place, first time. So the 4-hour emergency access target is well recognised as the key barometer for measuring patient safety in the health system. And we as a board are absolutely committed to try to maintain that number, because it's about measuring patient safety. So, as I said, through the efforts of the whole system, and that approach and the culture that runs through that system about the collaborative approach, we continue to be the highest performing mainland board. The latest weekly figures published to the week ending the 17th of November show Tayside performance is just under 90%. The Scottish average is 63%, with just 4 8-hour breaches. There's 3,147 across Scotland. Tayside had just the 4. And in terms of 12-hour breaches across Scotland, there were over 1,394 in Scotland, and not one of those was in Tayside. So, as well as making sure everyone who attends at one of our emergency departments is seen in a timely way, which minimises, as I've just said, patient harm, the true impact of the unscheduled ED is felt across the whole system. That's why our whole system needs to continue to maintain a focus on medical beds, delayed discharges, surgical admissions, and elective activity, to make sure that each part of the system retains the opportunity to play its part in keeping the patient flowing safely. Because if we don't have that in all those places, it's simply not going to enable that flow to continue to flow safely. Which brings me to the Flow Navigation Centre. And this, as board chair, we are an exemplar across Scotland. And when I attend national board chairs meetings and meetings with the Cabinet Secretary, it is an area where the high performance of our emergency department teams set not only about the challenging conditions that we've had over the last 5 years, but also the really challenging positions that we have for the NHS currently. And that's attributed to the establishment of that enhanced NHS Tayside Flow Navigation Centre. So it's staffed by senior ED clinicians, emergency department clinicians, and the Flow Navigation Centre provides advice and remote assessment for patients with the offer of rapid access to clinical assessment. So this is now embedded in as our business as usual. We've had this now for a number of years, and currently our ED clinicians respond to around about 700 calls every week from the Scottish Ambulance Service, from NHS 24, from minor injury units, MIUs, from primary care colleagues, and also from several other key stakeholders. So that includes also more than 100 callbacks per week from consultants directly to patients themselves. And the positive outcomes result in fewer unscheduled care attendances at ED, making sure that we're treating and addressing the concerns of patients in the right place. So NHS Tayside have also developed professional to professional call handling in many other specialities throughout the organisation. So that accounts for thousands of calls each month and includes specialities such as acute medicine, as I referred to as ED, frailty, medicine for the elderly, stroke, cardiology, surgical receiving, paediatrics, and primary care. So we have that professional to professional call handling. And the main aim of that is to ensure, again, that patients receive the right care in the right place. It's not at the right time, it's the first time. And I think that's really key. That reduces waste and duplication in the patient journey. It reduces concerns for the patients and the families and the carers, and it results in a reduced length of stay and a far better journey for the patient and for the families and those around the patient. So rightly, our teams want to maintain their high-performing ED position. As I said, it's not just about the number. It's one of the main areas which truly serves to remind everyone that behind every statistic and every figure, there is an individual. In this case, it's a patient. It's an individual and the family and those around those. So it's really important. So I'm now going to pass over to Nikki, who's going to take us through some of the key performance delivery areas. Thanks, Nikki.
Okay, thank you, Chair. Before I begin describing our performance journey at this moment in time, I just want to take a moment just to say how proud and privileged I am to have taken up post and to be part of leading NHS Tayside and part of Team Tayside. Since taking up post in July, I have had the opportunity to build relationships across our whole system. I've been listening to and learning from our colleagues. I have been taking time to understand patient experience and public experience. I've been reading lots and I've been learning about our ways of working. And I guess what I've learned is that whilst there is lots to do, there is so much to be proud of as well, and I really am. On that note, I want to begin this presentation by acknowledging those that I work really closely with and saying a sincere thanks, both personally and on behalf of the executive team, to every member of staff working within NHS Tayside, across our health and social care partnerships, within our primary care teams, and across the many organisations that we work with every day and we could not deliver our services without. It really is by working together that we can deliver the best for the people of Tayside. And that takes me on actually to really important relationships with the employee director and with our trade unions and with our staff side colleagues, and the commitment that we have to doing what we do in partnership in line with our partnership promise. And can I extend my thanks to my direct team and to my extended leadership team for your support and your leadership, and to the board for your direction. So that leads me on then to talking about our current performance within 24-25. First up is our ED for our performance, and the chair has just covered that, recognising not only the commitment for our teams within the emergency department, but that whole system response across all of our hospitals and all of our community teams across the health and care system. Moving along then, you will see that we are ranking secondly on the top for new outpatient waits. And that's second again for total outpatient activity appointment. And that's really good news that we're continuing to deliver well within this area. Diagnostics remains within a stable position, and we are delivering more than the agreed number of our activity plan that we set out at the beginning of this year. Similarly, we are in a stable position for our planned procedures, and we are on track to deliver our agreed activity. Looking ahead to cancer, we have an excellent performance for 31-day targets, and we're ahead of the Scottish average. However, our 62-day cancer performance target is proving very challenging, and I'm going to pick that up in the next slide in more detail, because it's not where we want to be. And what I want to do is outline some of the actions that we are taking to help improve this position. There really continues to be better news for delayed discharge. And you'll remember from what Lorna has said that we made significant improvements up to March of this year. And we've maintained this and indeed even improved it. And that is absolutely down to a partnership, collaborative effort between our colleagues in the 3 health and social care partnerships and our acute teams. And a huge thanks to them all for all of the work that's happening there. Our partnerships are actually amongst 3 of the highest performers in Scotland. And I particularly want to recognise that. And what we're seeing in the delivery of that is integration in action. Finally, the chair said I would pick up in more detail our CAMHS performance for 24-25. And it really is brilliant news that our teams in child and adolescent mental health services are continuing to work hard to design our services. And we have now sustained the 90% target for the past 9 months. What I would recognise, though, is in addition to our CAMHS pathway for people needing to access specialist mental health services, we have another pathway to support children and young people with neurodevelopmental needs. And that is an area of focus for our clinical teams at this moment in time. And what we're doing is working closely, not just within our health services, but with our multi-agency colleagues across Tayside to support access to the needs that best meet individual children and young people's support needs in a more timely way. What I'll move on to then is our 62 cancer day improvement plan. Unfortunately, we are a low-performing mainland board for all cancers across Scotland. And NHS Tayside performance is 63.5% for September, and that's against an average for Scotland of 70%. It's a priority for me, for my team, and for the board to address this. And I think it's important to acknowledge the areas of challenge that we face in this area. And that's around staffing, it's around equipment, and it is around pathway issues. In relation to staffing issues, waits for colonoscopies continue to be the main breach reason for the 62-day pathway, with extended waits mainly attributed to workforce challenges. There's also reduced urology medical workforce, which is continuing to cause delay across our prostate pathway. In relation to equipment issues, PET scan wait times continue to exceed target, with some equipment failures having impacted on our capacity, which we are addressing. In relation to our pathways, there tends to be an increased trend ongoing in relation to urgent suspicion of cancer clinics and diagnostic tests. And this is adding pressure in terms of the waiting list for our cancer services in Tayside. The urology prostate pathway remains our biggest challenge in demand for diagnostic tests, and there are significant workforce challenges, which is also causing delay in terms of our surgical treatments. And the lung pathway is becoming increasingly challenging due to waits for nuclear medicine, radiology, and outpatient clinics. So I guess it's important that we can be clear on understanding why we have a deterioration in the performance. I guess the question for us then is, what are we doing about it? So this is absolutely an organisational focus to improve our performance against the 62-day pathway. And what we're working on is ensuring that we have monthly cancer performance meetings in place, chaired by our senior leaders. There's an explicit focus on service planning with proposed targets for service delivery at different pathway stages, recognising that each of these pathways are facing different challenges. We're developing tailored support for our teams to support their planning as we move into 25 and 26. And that is looking at both our capacity and the gaps that we face, as well as what opportunities we have to move forward and to deliver increased performance in this area. This is going to be an increased focus in our wider organisational senior meetings, and that includes a focus at board, where we'll be taking a much closer look at how we will support improvement in this critical area and continue to follow that through in the coming year. One of the things that absolutely brings me joy in this role is the ability to create the conditions to focus on quality and to support us to work together across all of Tayside as a whole system, recognising it's by working together that we will deliver the best for our population. So as we move on to talking about our quality, and as you've seen, I guess from earlier slides in the presentation, what we're looking to do is balance. Whilst we look at our performance, we look at our finance, we also look more closely at our quality too. I want to recognise how dependent we are on all parts of our systems, all of our teams, our clinical teams, our operational teams, our business enabling teams, working together to enable this to happen. One of our key priority areas that is outlined here is around population health. And we need to be aligning this with our Scottish Government priority areas and recognising there's going to be a new population health framework coming forward, which will inform work for us in the coming year. We have a new Population Health Committee, and that has an ambitious agenda, seeking to drive forward work that we're looking to do to reduce the healthy life gap and to make sure that we are considering inequalities in all of the decisions that we are taking. And this includes connecting into our communities with our local populations and with our wider partner agencies through our community planning partnerships, through public health and through health and social care. Moving down then into general practice and primary care. We talk about shifting the balance of care and delivering care within our communities. And what I want to do is, I guess, is recognise that right here, right now, our GPs and primary care services are the absolute cornerstone of what we are delivering for health and care in our local communities, often the first point of contact for the population. Through our health and social care partnerships, this is an absolute priority, and primary care sits as a priority for the board too. And we're going to continue to ensure that we continue to focus on supporting general practice and primary cares across all areas of primary care, recognising optometry, dentistry and community pharmacy too. Moving on then to mental health and learning disabilities. We recognise that supporting our population involves spanning many organisations, and it's really vital that we continue to focus beyond our inpatient delivery of services into the models that we have within our community settings. Our community models continue to have a whole system support, working together across health and our care services, and also closely with our third sector services and the services that we commission. A worked example that we have is how we're supporting the transition of inpatient learning disability beds from accommodation and facilities which do not provide therapeutic environment into environments of care and community-based models. Next up is winter planning, and this is one of our more well-established processes that we have in place to really be working whole system. And that is based on several years of successful delivery, refining each year and adapting to meet the demands of our population over winter. On a daily basis, our teams come together in order to support the actions that we need to take based on the pressures that are faced on our system. And I want to thank them for the work that they do each and every day to make sure we remain agile and active over the winter period. And that is standing us in good stead as we head into winter this year. A key aspect of our winter plan is our flow into hospital, and that includes the flow through our whole system and how we support prevention of admission and also how we reduce delayed discharge. We've touched on this already today, but we really are in a good position compared to other board areas. And that did not happen overnight, and nor did it happen by accident. Teams work really hard every day to ensure the delivery of this so that we're delivering the best we can in a joined up way in our local communities for the people of Tayside. And I want to finish this section by linking to our property footprint. It's one of the more ambitious plans that we have for the future. And as Lorna has said, we have one of, if not the oldest estate in the country. So we need to look at opportunities of how we deliver our services differently. And we really have an opportunity in Tayside working with our partners and other agencies to look at the opportunity that co-location may offer or be able to bring our services together, both in terms of enhancing our team working, but also when the whole system is financially challenged. It goes without saying that anything we can do to work together, to rationalise and to share property and to build things better together has to be a positive step for us moving forward. So then, under quality, I think it's just really important to highlight and to showcase some of the amazing examples of work that we have where teams in Tayside are truly leading the way. I'm going to highlight a few of these, and the first of that is our UNICEF Gold Baby Friendly First. NHS Tayside is the first health board in the UK to be awarded UNICEF Gold Baby Friendly accreditation. That covers our maternity, our neonatal, our health visiting and our family nurse partnership services. This initiative is based on a set of standards designed to provide parents with the best possible care to build close and loving relationships with their babies. It requires a real significant achievement to achieve these standards, and it's testimony to the hard work of all of our teams. Members of the UNICEF Baby Friendly Initiative have visited and taken a tour of our maternity and neonatal units, and they said the NHS Tayside teams was visionary in its approach, and that is absolutely something to be celebrating. The next area is around our robotic assisted surgery. NHS Tayside's robotic surgical service hit a major milestone, which you may have seen on social media this week, with more than 1,000 procedures for patients with complex surgical needs. The robotic associated surgical service has continued to go from strength to strength from when it was first introduced 3 years ago. And teams have carried out procedures in colorectal, urology, gynecology, ear, nose and throat specialties. And the team have also delivered the most cases in Scotland on a single multi-agency robot. In terms of drug use support, it's really important to acknowledge the work that's happening in this area, and Tayside has been really successful in implementing the MAT standards, which are medication assisted treatment standards. Recently, Public Health Scotland has assessed these and supported our green rating in 9 out of the 10 standards. This is a result of really focused work, learning from in the wake of the Dundee Drugs Commission report and recommendations, and I want to acknowledge and pay testimony to the work of the 3 alcohol and drug partnerships that we have within Tayside. Another first is for our Tayside Mental Health Inpatient Unit. NHS Tayside's Intensive Psychiatric Care Unit at Carsview are celebrating to be the only unit in Scotland to have achieved accreditation by the Royal College of Psychiatrists. It's important to note that across the UK, only 13% of those that enter the scheme will actually achieve accreditation. It's difficult to achieve it. The standards of excellence are required are really high and needs real assurance from staff, from service users, from carers, from commissioners and from regulators around the quality of the services being provided. So huge congratulations to our teams at Carsview. That's an absolutely significant achievement. Really important also that we talk about the work that we're doing around sustainability and around climate change. There's a huge amount of great work underway, including tackling plastic waste, replacing our plastic milk cartons with eco bags. We've reduced waste by 87%. We're saving thousands of pounds every year, and we're using the Scottish Government's Green Public Sector Estate Decarbonisation Scheme funding. We've installed solar panels on roofs of primary care buildings and increased insulation. We've also been part of the Scottish Government's Green Theatres programme, and NHS Tayside has decommissioned all nitrous oxide cylinders and shut down pipelines to prevent gas wastage at Stracathro Hospital, Perth and Ninewells hospitals. And one area that deserves our truly special shout out is the work of our volunteers. NHS Tayside achieved recreditation of this important award, recognising the contribution and value of volunteers across our health and care system. So can I please say a huge thanks on behalf of the board to all of our volunteers who are absolutely integral to the care that we deliver. Thank you for the opportunity really to have paused and to have shared with you work in relation to both the performance and the quality of our services. And I'm now going to pass back to the chair, who's going to talk to you about our people who truly are our greatest asset. Thank you very much.
So as Nikki said, our people, they are our greatest asset. It's very easy to say it, but we really do mean it. And we have to live that in what we do. We've got over 14,000 staff in Tayside. That means as a board, we are maintaining, as far as possible, a stable position in terms of numbers. Turnover rates are slowing. Everyone will be aware that with the challenges of the COVID pandemic coming out of COVID, we had some challenge, particularly around retirement of staff. Retirement is now generally stable. As an anchor organisation, we are the biggest employer in the region. We will continue to introduce employability schemes and also apprenticeships, because it's hugely important that we grow and develop our workforce, our own workforce for the future. That's really important because our age profile is showing, for example, our staffing percentage. For those over 60s, we've got 12.2% of our staff are over 60, and in our over 30s, under 30s rather, it's 14%. So 14% of our staff are under 30s. So if you balance those two out, you're going to have 12.2, nearly 14% who are coming up for retirement, and just about slightly less than that we currently have in the younger age demographic of the workforce. So for some comparison, the national average for the over 55s shows NHS Tayside at 26.1%, with the national average of 24.3%. And recruitment is a challenge. It's a challenge nationally. It's a challenge across Scotland. And in particular, we face challenges in psychiatry nationally, and Tayside's no exception. 40% of our consultant psychiatry posts are unfilled, and 75% of those were in general psychiatry. So a significant recruitment strategy. The shortage of psychiatrists is not limited to NHS Tayside. As I said, that's very much a national picture, and it is a challenge for several of our colleague boards across Scotland. So we have coordinated several recruitment drives in and around that, and that's been hosted both nationally and internationally, and every agency and platform locally we have explored in order to try to secure staff in this field. And while that has provided some candidates, it's not yielded the numbers that we require to match the vacancies that we have. There is huge competition across boards for those key individuals, and as the 5th largest board, we also understand the attraction of the Central Belt as well. So we have used locums to fulfill and utilise those gaps wherever we can secure them. But given those challenges and given what I've just outlined, we are giving consideration about the design of the workforce that we have, the workforce design within mental health particularly, to ensure that we are diversifying the team, that we're upskilling where appropriate, and we're enabling the team to diversify, making sure that we use the best of the skills and the talents that we have within the teams, and optimising the range of appropriate professionals that we have to provide care. We've had some success in terms of nurse recruitment, and there's definitely a much more positive picture here. Nursing is always an area of focus, and we've recently appointed a new nurse director, and we are taking a very proactive approach this year. And the key highlights coming forward from this is that we have 344 newly qualified practitioners who've accepted offers across a range of roles. And this is the highest number of newly qualified practitioners that we have had ever in Tayside. And I think that's testament to the work of the teams across Tayside, but also to the training and the support and the development opportunities that are in place. Job offers have been made prior to final placement to encourage recruitment and support retention. It's nothing better if you have enjoyed and you have worked within an area, whether it's across health and social care, if you feel that that is a part of the organisation that you would like to invest your skills, your talents, your opportunity, to be offered the opportunity to do that has meant that we have increased and improved the retention. And that's really evidenced. I could say that, but we actually can evidence that. So in September 2023, our turnover was 11.8%. And in September 2024, it was 8.4%. So a significant improvement in our nursing recruitment and our success. And it's also about growing our own. So we collaborate very closely with Dundee and Angus and Perth colleges. We have over 100 Band 4s now through the assistant practitioner training to support the registered workforce. And we're also seeing agency reduction across the system. We also need, as an organisation, to tackle sickness absence, and it remains a challenge for us, as it does for all boards. But we are higher than the Scottish average in terms of our sickness absence, and therefore we are a really targeted focus on our absence at a strategic level, and we are looking at a test of change for our frontline staff to support our staff further. We also need to find ways, and we are indeed doing that, to support staff better, and that is a key priority for the board. And we also need to be much more innovative in terms of our approaches, so that our staff feel that they are really being supported. The staff voice, loud and clear. As I said, our staff are our greatest asset. Well, they're our greatest asset, but they're also the experts in their field. They know their field. They're the best possibly placed to be able to advise, support, and our new culture work is encouraging more ways for staff to have their say, to be listened to. We talk about speak up and speak out and listen out. So we are really working very across that, so that we can ensure that we have closer connection with our leadership teams. Looking after our staff, their health and their well-being, we have seen increasing pressure being placed on our workforce, and indeed the unprecedented challenges of the past few years have highlighted with even greater importance the needs that we have to ensure our staff health and well-being. I'm going to cover that in a slide that's coming up just shortly. So, amplifying our staff voices. We have the Area Partnership Forum, the APF, and the Area Clinical Forum. These are two key ways, and indeed are pillars of our governance at the board, in which we can have a dialogue with staff and ensure that the staff voice is heard and rings true and is clear. So the Area Clinical Forum and the Area Partnership Forum report to Tayside NHS Board, and they bring honest and meaningful insight to the board table. And these are two very, very important sources for us as a board. So ahead of today, we asked the chairs of these two committees to reflect on their key areas in order we could present their work today. So first we had the Area Partnership Forum, and indeed the Area Partnership Forum has restated its belief that our staff are the subject matter experts. And I absolutely agree. They are our subject matter experts, and they should be seen as the solution to the challenges health and care services face. We need to listen and incorporate their expertise and their values into the work that we are going to take forward. So the Area Partnership Forum thanks all staff across the organisation for their hard work and their dedication in these times, recognising the increasing pressure and demands across all of our teams. And as Nikki said, partnership working must be at the heart of everything that we do as an organisation. And therefore, following successful conferences in 2022 and 2023, the Area Partnership Forum advises that they were delighted to launch the guide to partnership working at this year's partnership conference. It really sets out what partnership working means. When I first joined this board, I wondered, what is partnership working in partnership? And we have been on a journey and really supported, and I've been supported in the work of what partnership working really means and how we can really make that fit into the organisation and how we all work together. So the APF relaunched the new partnership promise, and I have it in my office, and it's my reminder every day about the importance of that promise. And with the new leadership team and the co-chairs of the Area Partnership Forum, Chief Executive and the Employee Director, we've brought a renewed focus on partnership being at the heart of everything we do. We may say that in terms of our launching our partnership promise, but we intend to really embed that and are absolutely committed to renewing that focus. So we then move on to the Area Clinical Forum, and members are keen that there is widespread recognition of the current level of pressure and challenge. And I hope our chair and colleagues of the ACF that I have articulated, as has Nikki, are really understanding and will do our very best to spread that recognition of the real level of pressure and challenge that is unprecedented in health and care. So the ACF has noted what they see as a perfect storm of an increasing clinical need and demand, and that meeting a backlog of patients within workforce and the financial challenges. The Area Clinical Forum pays tribute to the dedication and commitment of all clinical and non-clinical teams, and they believe that harnessing collective clinical voice to provide professional advice continues to be key to success. And I'm really pleased as chair to have seen the development and the increase harnessing of that voice. The Area Clinical Forum also concurs with the Director of Public Health's report in underscoring the critical need to promote equitable access to services, with a focus on addressing the causes and consequences of deprivation. The ACF felt that including consideration of public health implications needs to be and should be a required element and a key element alongside equality and finance, and that should run throughout all the strategic papers. Investing in innovation is a system critical requirement, and the Area Clinical Forum here in Tayside believes that to deliver high quality care efficiently and effectively, we need to have, and there needs to be, sufficient and appropriate infrastructure to support this. And again, at the very bottom, we see that the ACF is committed to leading, enabling and supporting NHS Tayside to find solutions and drive improvements through clinical advice to shape future service delivery. We'll come to the next slide, which is about caring for staff, and it's about well-being matters. So I think you will have picked up through the presentation that this has been a golden thread throughout the presentation today. And I will say it again, as it's so important. The greatest asset we have here in Tayside is its workforce. And working in healthcare, it's very demanding. It is demanding. And sometimes they can be distressing as well. And while staff members are committed and motivated to provide high quality care and have valuable coping strategies in place, that needs to be supported because the impact of their work can be significant. And that's why we need an ongoing and a positive and proactive approach to support our staff well-being. We've made a commitment to prioritise staff well-being, and we've done that over a number of years. But this year we are redoubling those efforts to ensure that those who provide exceptional care for our communities, that they also receive similar support in their workplace. For us to be effective, those working in health and social care, they need to be as healthy as possible, but they also need to feel supported, both physically and emotionally and psychologically, and they must feel psychologically safe at work. So research shows, I think we don't need the research, the evidence is there, we know it, we can feel it in the work that we do, is that enhancing staff well-being significantly boosts productivity, care for patients, the quality of patient care, patient safety, as I referred to earlier on, patient satisfaction, financial performance, and the sustainability of our health services. And so, as the slide shows here, staff well-being really does matter, and it matters to me as chair of this board, and it matters to the chief executive and her teams as well. And here, we're illustrating here some of the ways in which we are making sure we are looking after our staff. We're always learning, it's always evolving, but these are some of the examples of the work that we're doing. So we start with the staff wellbeing group. That's a multidisciplinary group which meets bi-monthly, and that goes to explore ways to improve health and well-being. And the group is led by staff the staff set the agenda for this, and this has been instrumental in supporting initiatives and campaigns. In NHS Tayside, we also have our own staff wellbeing service provided by the Department of Spiritual Care. And the model here delivers a really effective and really supportive staff wellbeing service with hundreds of health and social care staff in Tayside accessing and using the service every year. We also have over 300 staff wellbeing champions embedded here in Tayside within our workforce across the health and social care partnerships and in the acute sector. We had a conference only a couple of months ago, which was my pleasure to be at, and really to see and speak with some of these 300 staff. They're all trained now to support well-being within the teams, and we were encouraging discussions, and they in their turn, in their work that they do across the teams, encourage discussions about mental health well-being and challenges, and by connecting colleagues and staff to relevant support. We also continued with our rest, relax and recharge rooms, the RRR rooms. We introduced some of those during COVID, and they continue to be available for staff to use across Tayside. We've looked at them again and we've refreshed in many cases, and they are designed as dedicated spaces away from the busy environment, encouraging staff to unwind and relax. We also have, coming to the last two, we have staff networks. These are really active, and they offer support, guidance and run events on issues which matter to staff, including disability, equality, inclusion, LGBTQ and carers networks. And then finally, our final one in the staff wellbeing framework, in terms of what's coming next year, the very early next year, we're going to have the new Tayside staff wellbeing framework, and that sets out our commitment to supporting staff health and wellbeing with a vision for how we create as an organisation and as our workforce the conditions for staff to flourish and reach their full potential at work. Part of that, we have how we recognise our staff, and we have our Star Awards, and I'm really delighted that having been due to retire, I'm actually able to stay on, because this is one of the highlights of my year. Is before we head to the question and answer session, I really wanted to finish with that final tribute to our staff, because we recognise some of them in our hugely successful Star Awards. Recognising staff is a real keystone for our people and culture approach. And for me and for those that are involved in it, it is just one way that we can really recognise all members of the Tayside staff family and their hugely inspirational work. And that's what, from these events and this particular event, it is so inspirational, and it makes us all realise why we're here and why we do the jobs that we do. Today marks the last day for nominations. It's not too late. You still have, I think, a couple of hours to do that. And they take place on the 28th of February here in Dundee. However, for as much as we know that the nominations and these awards mean, and the recognition that the STAR nomination brings, at the same time, I think we are also, as an organisation, looking at how we can do this as we move into the next phase of our People and Culture programme. And I look forward to, from the back benches, seeing how that work comes forward as we move forward. So the last word, therefore, before our question and answers, must rest with our staff. And I started at the beginning by saying thank you on behalf of the board, and I'm going to do that again and say that the board, we are hugely grateful for everything that you, and I'm talking to each member of staff here across our systems, that you do. It's been a huge privilege to lead this organisation and as chair over the last 6 or so years. And the board, which I chair, and Nikki as the chief executive, we are constantly impressed by the efforts of our staff. And we are immensely proud of the commitment and dedication that they have to the people of Tayside. That concludes the first bit of the presentation element, but I'm also going to chair the question and answer session. And we have, I think, 4 questions that have been submitted. And can I ask the Director of Communications to come and support that? Thank you.
So as the chair set out at the beginning of our session today, we did ask for questions in advance from some members of the public and staff, and we've actually received 4, which I will summarise. Any questions that we do receive, either in advance as we have, or from the floor today, they will be going on our website and they'll be answered in full, and that will go on. We have a deadline of within the next 4 weeks, but we'll get them up as quickly as possible alongside the recording of this session as well. The first question that we have is around car parking at 9 Wells, which probably will not come as much of a surprise to people. It's a 2-part question. The first is around the number of spaces that we have and a shortage, as we know, in the peak times, but also if staff or visitors or anyone is having to park off-site because there's no capacity on-site, then what do we have in place to ensure safety and security? So the response that we have, I've got to say that for all these responses, we've gone to the services themselves and the directorates, and they have provided full responses, which will be, I will summarise today, but they will be in full on the website. We do offer free parking, as all health boards across Scotland do. We have actually one of the largest car parks here at 9 Wells. There are nearly 2,500 car parking spaces. So the question about whether we would be able to provide extra spaces, realistically, that is not within our scope. We will not be providing any extra spaces. What we have to do is optimise what we have and make sure that we are providing them in the right places for the right kinds of people, the visitors, the patients and the staff. So therefore, a car parking steering group has been established. They have the aim of improving access for people that are coming on to our site. They are supporting a review of the car parking strategy, and they are exploring a range of options. As a public sector organisation, we also have sustainability targets to achieve and sort of green targets. So therefore, we are trying to promote and encourage more sustainable travel options around modes of transport and car share, lift share, car share, public transport options. But we know that obviously some people are not able to take public transport onto site. So the car park steering group is looking at these at the moment, and they will be looking at all of the options that are available to us to try to improve the experience of people that have to drive or come onto our site. The safety and security aspect of it, the group will also look at that, but they are we do have make sure that pedestrian, you'll see from the site, the pedestrian, the pathways, they're well maintained. It is a bright environment. They are brightly lit, but we have just invested in a digital CCTV system, and that's in place now, and that's obviously to increase the range and coverage across the hospital. So as I say, this will be responded to in full on our website. The second, I've got a couple of questions which are around workforce and workforce planning, really. The first question is around rostering policy, and it's actually non-clinical rostering policies. Someone has asked around the rostering policy that we have in place and whether that places extra it restricts managers being able to introduce different kind of rostering programs and shift patterns. The individual is asking that this may have a negative impact around staff, around staff welfare, but also on the prevention of, as a manager, being able to save and make efficiencies. So how do we justify having such a policy in place? The response to this has come from the HR Directorate. The rostering policy is obviously designed to ensure that individuals who work shifts have a working pattern in place that complies with legislation and good working practice. It's designed to ensure that we're compliant with the requirement to meet the 11-hour gap, which is between shifts, and it also ensures appropriate breaks are scheduled into the rota pattern. It also ensures that the individual has appropriate sleep and rest time if it's between like a day shift and a night shift. And however, what the policy does not preclude is a change to working patterns. They have to still ensure that reasonable rest and gaps are in place, but there is a possibility to do that. So that's the response for that one. The other workforce issue is around a very specific service issue around the public dental service at Brockden Dental Laboratory, and it's around dental technician who works in the laboratory, and just about a workforce pattern and workforce planning around that, and the absence of a laboratory manager who is actually on site. As I say, that's very specific, and the clinical dental director of the public dental service will actually is more than happy to meet the individual who has asked the question. But I guess generally what we would say is that often services that are managed by clinical or service managers, they can access information on specific technical aspects if and when required. They have the skills to operationally manage a service, and that does not necessarily have to be on site. But this is a general point across all our services. When a post is vacated, it is incumbent on each service to actually assess whether a like-for-like replacement or whether we would actually change a workforce model. And that means the status quo can change depending on the service need at the time and the workforce development. These are all elements that the public dental service has looked at. And as I say, the clinical dental director is more than happy to meet with the individual. We have a final question, which is relating to the use of external contractors within NHS Tayside. And obviously, it is relating to the financial impact of that, perhaps paying thousands of pounds to businesses that are not on site, that are not part of our in-house team. And the specialist, the question is around contractors maybe having a call-out charge of £100 before they come onto an NHS site. The response which we have is that we have a very large and diverse estate. That is true. We've heard today that it's one of the largest in the UK. And to maintain that, we have one element around our pre-planned maintenance, and most of the day-to-day challenges are actually covered by our dedicated in-house team. However, we do have a specialist clinical environment that has a lot of specialist equipment and kit. That cannot, the maintenance of some of those and also on call and in the out of hours period, that cannot be provided by in-house teams. However, when we do contract with an external provider, we do have to follow obviously established guidance. There's Scottish Government protocols, there are procurement portals. We comply with all of these, and even when a contract has been awarded, there will be points written into the contract where we review. They are formally reviewed by our procurement and property teams. In response to actually though the financial aspect of the question in terms of what we are spending on external contractors, there's a new group that's been set up in NHS Tayside called the Sustainability and Recovery Group. That group has actually identified external contracts as an area that we will be looking at in further detail. There was a session earlier this month, so actually there is an independent review that's actually being taken forward in response to that. It is an important point, and it's one that's being taken forward. And that concludes all of our written questions in advance. So I'll pass back to you to see if there are any questions, Chair.
Thank you very much. Are there any other questions that you would like us to take today? So if there are any other questions, then obviously very happy to take those, and we can post those, as we've said, on the website. And I just really wanted to thank everyone who has made the effort to attend either online, and we'll find out later, I think, how many have attended online, but also here in the room. And it will be on the website. I think the slides that we've used today will also be on, so there will be an opportunity to see those and share those more widely. But again, my thanks to everyone for your attendance today. And I hope that the annual review that we have presented has provided some information and some clarity around the work that we have been doing and what we're looking at going forward. Thank you all very much indeed. Thank you, Nicholas.